Today, we will focus on a skill that is just as critical as your clinical knowledge: effective communication. Communication is not merely talking. It is a dynamic, two-way process of exchanging information, ideas, and feelings between a sender and a receiver to create true mutual understanding. The objectives of today's class are to enable you to define effective communication and understand its impact on patient outcomes, describe the key components of successful clinical communication, identify common barriers encountered in healthcare settings, outline a structured approach to patient interaction, and demonstrate these skills in a simulated clinical setting. Now that we understand what we aim to achieve in this session, let us first examine why effective communication is so essential in healthcare practice. Communication is not an abstract concept. It directly influences patient trust, treatment adherence, clinical safety, and overall satisfaction. Let us now look at how communication functions as a clinical tool. When care is delivered through effective dialogue, it leads to meaningful outcomes, building trust, improving treatment adherence, reducing misunderstandings, and enhancing patient satisfaction. In clinical practice, communication directly influences the quality of care delivered. In order to apply communication effectively in clinical practice, we must first understand what we mean by communication in precise terms. Let us now examine its formal definition. Communication is defined as the dynamic, two-way process of exchanging information, ideas, feelings, or opinions between a sender and a receiver to create mutual understanding. First, communication is dynamic. It is not static or one-directional. It continuously evolves during interaction. Second, it is a two-way process. Effective communication requires both speaking and listening. Without feedback from the receiver, true understanding cannot be confirmed. Third, communication involves not only information, but also ideas, emotions, and attitudes. In healthcare, emotions often influence understanding as much as facts. Finally, the goal of communication is mutual understanding. It is not sufficient that the doctor speaks clearly. The patient must accurately comprehend the message. In clinical settings, effective communication is achieved only when both parties share the same understanding of the diagnosis, management plan, and expectations. Having understood the definition of communication, the next question is, how does communication manifest in clinical practice? In healthcare settings, communication is not limited to spoken words. It occurs through multiple channels. Communication can be broadly categorized into four types. First, verbal communication. This refers to the spoken word, clear, structured, and empathetic speech tailored to the patient's level of understanding. The choice of words, clarity of explanation, and tone of delivery all influence comprehension. Second, nonverbal communication. This includes body language, eye contact, facial expressions, posture, and tone. Often, patients interpret meaning from nonverbal cues even more than from spoken words. Third, written communication. This includes accurate documentation in case records, discharge summaries, prescriptions, and instructions. Fourth, formal communication. This refers to structured, professional communication used to explain diagnoses, investigations, and management plans in plain language. It ensures that complex medical information is conveyed in an understandable manner. Effective clinical practice requires the integration of all four forms. However, in real clinical practice, these elements do not function in isolation. They come together during every patient encounter. To apply communication effectively, it is helpful to view each patient interaction as having a structured anatomy. Every clinical interaction consists of several essential components. First, clear verbal expression. Information must be presented in a structured and understandable manner. Second, supportive nonverbal cues. Appropriate eye contact, attentive posture, and a calm tone reinforce the spoken message and convey professionalism and concern. Third, active listening. Listening without interruption allows the patient to express concerns fully. It demonstrates respect and improves diagnostic accuracy. Fourth, empathy. Acknowledging the patient's emotions and concerns strengthens trust and therapeutic rapport. Finally, feedback and confirmation. Effective communication requires verification of understanding. Techniques such as the teach-back method help ensure that the patient has accurately understood the explanation and management plan. When all these components function together, the interaction becomes patient-centered and clinically effective. While we understand the ideal structure of a clinical interaction, communication in real-world settings is not always seamless. Even well-intentioned interactions can fail due to various obstacles.
Let us now examine the common barriers to effective communication in healthcare. In clinical practice, several barriers can interfere with effective communication. Medical jargon. Excessive use of technical terminology can confuse patients and limit understanding. Language differences. When the doctor and patient do not share the same primary language, important information may be misunderstood. Cultural differences. Cultural beliefs and expectations can influence how patients interpret illness and treatment. Time constraints. Busy clinical settings may reduce opportunities for thorough explanation and clarification. Poor listening. Interrupting patients or focusing prematurely on diagnosis can result in incomplete information gathering. After identifying the common barriers to effective communication, the next important question is, how do we overcome them in routine clinical practice? The answer lies in adopting a structured approach to patient interaction. Let us now examine a simple and practical interaction strategy that can be applied consistently in clinical settings. To ensure clarity and consistency, every patient encounter can follow a structured sequence. Greeting. Begin by introducing yourself and establishing rapport. A respectful and professional introduction sets the tone for the entire interaction. Listening. Allow the patient to narrate their concerns without interruption. Active listening improves diagnostic accuracy and builds trust. Empathy. Acknowledge and validate the patient's feelings or distress. Even brief expressions of empathy can strengthen therapeutic rapport. Explanation. Provide a clear and simple management plan. Avoid unnecessary medical jargon, and tailor your explanation to the patient's level of understanding. Confirmation. Finally, verify understanding. Ask the patient to repeat the plan in their own words. This ensures clarity and prevents miscommunication. A structured interaction strategy promotes confidence, both for the patient and for the clinician.
To evaluate your performance, especially during simulations and clinical postings, it is helpful to use a structured checklist. During patient interactions, ask yourself, did I introduce myself properly and establish rapport? Did I maintain appropriate eye contact and attentive posture? Did I allow the patient to speak without unnecessary interruption? Did I use open-ended questions where appropriate? Did I demonstrate empathy and acknowledge the patient's concerns? Did I avoid excessive medical jargon? Did I clearly explain the diagnosis and management plan? Did I confirm understanding, preferably using the teach-back method? As you progress through your clinical training, remember that medicine is not practiced in isolation from communication. Effective communication transforms clinical knowledge into meaningful care. Strive not only to become clinically competent, but also communicatively competent, because ultimately, patients may not recall every detail of what was prescribed, but they will always remember how they were treated.